In the medical world, sometimes the cure is worse than the disease. Say with cancer patients, where chemo is sometimes more harmful on the human body than the cancer itself. It forces a lot of difficult decisions. With COVID-19, we're beginning to understand more about how addressing this short-term threat may lead to big problems down the road.
I think we really have to be thinking marathon.
Dr. Stachin Moroshek is a pediatrician at Hennepin Healthcare. She says while the virus itself is a big concern, other health problems have come up during our attempts to control it.
Mental health, addiction has really been a struggle, and that actually has been a big increase in our patient volumes at our hospital. People with overdoses, people with, depression, people with anxiety. And, oh my goodness, I have to be extra special careful about hand washing and mask wearing. And those things are really starting to wear on people.
And those mental wounds could linger on long after the pandemic is over. Dr. Moroshek is also worried about the way this virus is affecting kids.
I worry about child abuse. Our primary first-line reporters are school teachers, and when the kids aren't in school, we've actually already seen our numbers of child abuse case reporting go way down. The other big issue that we've been struggling with as pediatricians is the vaccination rate for general well child care and the other things for general well child care, because so many families are scared to come to the hospital, so we really want our kids to come in and get vaccinated. We're really worried about the immunization rates falling.
That's why doctors are trying to get the word out to prevent a spike of other diseases and viruses in the coming months. Doctors also wonder about kids growing up in a world with less human interaction, the effect that might have on their brain development and social skills. Economists are also worried.
Look at the effect on the Minnesota state budget. We're off $7 billion because so much of it comes in from income taxes. Well, if don't have income, you're not paying income taxes.
Dr. Jean Bay is an economics professor at Augsburg. She's concerned the financial fallout from the virus may linger on for years. Many of the jobs that were lost may never come back, and many of the businesses in the hospitality industry especially may be gone forever. And the gaps between lower, middle, and upper class will get even wider.
People who can work from home, their lives may actually have gotten better. There's no transportation cost. They're still getting paid, right? But people who were involved in, physical activity, the restaurants and the nursing and all those kinds of things, they may be adversely affected.
And the trillions of dollars in federal aid that has already been given out, that money will have to come from somewhere, a bill Americans will have to pay someday down the road. Now, neither of these experts are suggesting we should simply ignore the virus and immediately go back to the way things were. Far from it. It's just that there is so much more to consider than just the virus itself.
So the question is, how do you protect the people that need protection? And how do you allow the majority of the people the ability to move forward so that we don't suffer economically as well as health-wise?
Big questions. Well, as you heard earlier, health experts are seeing a lot of new patients coming forward with mental health concerns due to the virus. If you or someone you know needs help, we have posted a list of resources on our website with Gordon's story.